Welcome to our online town hall. I'm just going to go over a little bit of housekeeping for you. One, if you have joined us on the call, we really appreciate you being here today and participating. So just want to explain a little bit of the overview of how the call works. So we have several different panelists that will be providing some information and some presentations, and then we're going to have time to take questions that were provided by residents who submitted those questions beforehand, and we will have our panelists be able to answer those particular questions. There is a chat feature here, so just be aware in the chat feature we have a couple of moderators who can help try to answer some of the Q&A that ends up in the chat feature. So if you do have a question and it wasn't necessarily answered here, our chat moderators, I believe there are 3 here today who are assisting us: Mandy Swartzing, Gabino Arredondo, and Trina Jackson in the chat. So they will be able to respond to some of the questions you have, as well as some of the panelists if they're able to pop in there into the chat. And also just want to remind people that this will be rebroadcast on KCRT. So if people didn't get a chance to check it out, we will make sure that this information is shared as widely as possible with everyone. And with that, I am going to turn this over to my co-moderator, Chris Whitmore.
All right, thank you so much, Michelle. Again, my name is Christopher Whitmore. I'm the Chief of Staff for Richmond Mayor Tom Butt, and I'm so pleased to be co-moderating today's town hall alongside Michelle. I want to say good morning to our great panelists. Good morning to all of the community members tuning into Zoom. And we're very excited to be broadcasting, looks like, to YouTube today. So good morning to anyone watching us on YouTube. Like Michelle said, I want to start off by reminding our attendees that today's town hall is to give you an update on the City of Richmond's response to COVID-19. And we are so glad to have a special presentation today from LaShonda White, who is our Deputy City Manager for Internal Services, and also from Jasmine Jones, who is the Executive Director of Ed Fund West, who will be providing a presentation on the newly launched Richmond Rapid Response Fund, also known as R3F. In addition to presentations from LaShonda and from Jasmine, you will hear from Richmond Mayor Tom Butt and City Manager Laura Snideman, with Police Chief Bisa French, Fire Chief Adrian Sheppard, and Emergency Services Manager Genevieve Pastor-Cohen present to help answer questions about the city's emergency operations. Now, as you can imagine, we have many community members tuning in to today's town hall, and we are so glad that all of you can join us. And because of the number of people that we have tuning into the call, you will be in listen-only mode, but we do want to let you know that this call is to interact with you. We want to answer as many questions that we can on this call, and we want to thank all of the individuals that submitted questions prior to our submission deadline. And if you listen to the presentation and you happen to come up with a question, as Michelle said, please feel free to use the great chat feature at the bottom of your screen. And we do have city colleagues who will be in there answering many of the questions that you will pose. And now I'd like to introduce Mayor Tom Butt, who will now begin his remarks.
Good morning, everyone, and welcome to our second town hall dealing with the impact of COVID-19 on Richmond and how we're coping with it. I think you're going to hear a lot of interesting information today, and I hope that you find it helpful to you. So at this time, I'll turn it over to City Manager Laura Snideman.
Great, thank you, Mayor. I appreciate everyone's time and interest here this morning, and I really thank everybody who has worked so hard to be able to pull all of this together. I wanted to share a couple of different things this morning. While we would wish we would, could all gather together, I do hope these virtual forums are helpful in providing various information. And I want to focus on a couple of things: our health, our community, and our city organization, particularly our city budget. So as many of you know, as of the recording of this webinar, the county has done a very good job being able to slow the trajectory of the virus. So we're very excited that our hospitals have not become overwhelmed. We've been able to treat patients and we've been able to manage so far here in Contra Costa County. So we really appreciate everybody for following health orders and doing everything that you've been doing to keep us all safe. We also have learned that over the past couple of weeks, there's been a slight lessening due to this positive news in some of the restrictions. Some landscaping businesses, those who work in outdoors like construction, those types of things are starting to be able to come back, and folks are starting to be able to work again in certain sectors. But it is extremely important to remember that the Contra Costa County Health Order is the order that remains in place and that we need to follow. So as things start to change in other parts of the state of California or in other parts of the country, we here in the city of Richmond are going to continue to pay attention to the Contra Costa Health Order, and we need to continue to shelter in place for the moment. Hopefully those restrictions will continue to lift as we continue to do a good job, and all of the things that everyone has been hearing about and doing, including washing hands, staying apart from others, wearing masks when you have to go out for essential shopping or services. So that is all the good news. And again, the information will continue to change over time. We will continue to keep our website updated, as will the county. We know that this has had a very significant impact on our community. As of the recording of today, there are approximately 11,000 people who aren't working from Richmond who would like to be working. So we have really good news in terms of the fact that we have 3 separate grants that we have already been awarded, and we are in the process of being able to provide a variety of services to people who are out of work. One of the grants particularly focuses on those who are English language learners, and it is for a lot of basic needs, childcare, housing, utility assistance, that type of thing. And another grant is going to focus, 2 more grants actually are going to focus much more on workforce development. So these are programs that are going to be able to help prepare for people for new employment opportunities, possibly with retraining, buying things like work boots if you need that for a job, helping with interview skills, resume preparation, and again, trying to refocus where folks might be able to find employment in the near future. So we would encourage you to visit our website and find information about that. You will also hear a little bit later on about a wonderful community partnership that has come together with the Richmond Rapid Response Fund. And this too is going to provide a lot of help and support to many different people and organizations in our community. And then turning to the third area, which is about the financial impact on the city. We have experienced some downturn, obviously, with all this economic impact, and it's affecting both our current fiscal year budget as well as our next fiscal year budget. The city of Richmond operates with a budget that ends in June for the current fiscal year and begins on July 1 for next fiscal year. And we are trying to continually update our number and get the most up-to-date information possible. Our current estimate is that our budget for the current fiscal year might be affected by up to $7 million. The estimate for next fiscal year, starting again on July 1st, is $27 million. And while this has a lot to do with the COVID-19 pandemic, a lot of our sources of revenue have been impacted, primarily sales tax, but other sources too. It's also important to note that our expenditure growth has really been increasing over our revenue over the past several years. So we have really multiple issues to tackle here. I'm really pleased with the work that has been done so far, both in terms of getting information as well as the leadership from the city council and working with our bargaining groups and having all kinds of ideas coming in from community members. Our city council, our mayor has appointed an ad hoc committee. And so the council is working together and working with our employee groups to try and look at all kinds of different things that we might do to be able to address this issue. We have 5 different budget goals, and these are aspirational goals. I'm not sure we're going to be able to meet all of them, but they're a good way to think about our options. The first one is creating a structurally balanced budget. The second one is preserving services to the greatest extent possible. The third is considering impacts of COVID-19. A lot of our services are not going to be able to be provided in the same way they have traditionally been provided. Minimizing staff reductions and maintaining or trying to increase our cash reserves to the level that our policy outlines and maintains our bond ratings. So to accomplish those, we have looked at both sides of the equation. First of all, we need to look at new revenue sources. And second of all, we need to look at some budget balancing ideas, which include expenditure reductions. So we're in the process of doing all that. We don't know yet exactly how our services might be impacted, but it is possible that our services and the corresponding staff levels might be impacted. However, I want to assure you that we are examining every single option to close this budget gap, and we continue to encourage your involvement. We are having meetings probably every week at the City Council at this point, and trying to keep our website full of all kinds of information, including those budget balancing options and those revenue options that are under consideration. So we really, despite the fact that this is an extremely challenging time, it's also a situation where it shines a light on our resilience and our strength and our character, both as a city organization, as a community. I'm really grateful to the staff, our council, and everyone's effort and dedication to continuing to be flexible and adaptable and address this pandemic to keep us safe, to continue with resilience and be able to address these challenges. And with that, I would like to ask Mayor Butt to continue, please.
Okay, thank you. So at this time, we'll turn it over to LaShonda White, Acting Deputy City Manager for Internal Services.
Good morning, everyone. Thank you, Mayor Butt. Thank you, City Manager Snideman, and thank you to our wonderful moderators for inviting us to be a part of the panel today. Once again, my name is LaShonda White, and I'm the Acting Deputy City Manager for Internal Services. I've been with the city for over 14 years, and as a Richmond resident, it is still an honor to work for the city that I grew up in. So I am, like I said, happy to be here, and I've had the wonderful opportunity to work with a core group of organizations to help develop the Richmond Rapid Response Fund. Those organizations include the Mayor's Office in the City of Richmond, Jasmine Jones, Executive Director of West Contra Costa Public Education Fund, RISE, Richmond Promise, and Building Blocks for Kids. So that's been our core working group to develop the Richmond Rapid Response Fund. And I do just want to state that the fund has only been in the development for 5 weeks. It's only been 5 weeks in the making. So I'm really proud of the work that we've been able to do to establish this fund here in Richmond in support of our residents. So I am now going to turn it over to Ms. Jones, who will share a little bit more about the fund, and then we will tag team this a little bit.
Thank you, LaShonda, and thank you, Mayor Butt, council members, and everyone. Thank you so much. As previously mentioned, I am Jasmine Jones, and I'm the Executive Director of the West Contra Costa Public Education Fund, and I'm extremely grateful for this opportunity to share more about this work we've been doing collectively. And as a Richmond resident and someone who's born and raised here, I'm just so proud of the work that we're doing. And so I'll open up and share more about what the fund is, and then I'll turn it to LaShonda, who's going to share more about who the fund will serve. And then we'll close out the presentation just kind of discussing how resources will be dispersed as they come in. So the Richmond Rapid Response Fund is a wraparound initiative that will meet the immediate and ongoing needs of the community during COVID-19 pandemic and beyond this. The fund was developed through a community-centered process that began the first week of the region-wide shelter in place. And this process is known as the West Contra Costa COVID Community Care Coalition. And this group engages over 90 cross-sector stakeholders, including community partners and nonprofits, the City of Richmond, the West Contra Costa Unified School District, the county, local and regional coalitions, as well as many philanthropic partners. While we were coming together through this Community Cares Coalition process, we quickly realized that there was not a citywide fund that existed for the City of Richmond that could allow businesses and philanthropic partners to support our city. And so as we look to our neighboring cities like Berkeley and Oakland and San Francisco, we recognize that many of those cities had ways for people to invest in their communities. So due to the seed funding from the Hellman Foundation, we were able to quickly launch the fund, signaling to partners that they can invest in our vision for our community. The implementation of this fund has been broken up into 3 phases. In phase 1, we're going to focus on direct financial disbursements to residents. And that's the phase that we're currently in, having conversations with various funders, trying to raise money so we can get that resource out to our community. We're also developing a disbursement process currently that will outline how we will get those resources out. In phase 2, we really want to expand that kind of financial assistance and support to our small businesses and community-based organizations to make sure that they continue to have the infrastructure they need to support our residents beyond COVID-19. And lastly, to the point of this wanting to last beyond COVID-19, we really want to take phase 3 and figure out what's the infrastructure and kind of do a needs assessment to understand how do we want to continue to engage philanthropic partners and businesses beyond COVID-19 in a way that they can come into Richmond and support us. And so I'm going to turn it over to LaShonda now, who's going to talk a little bit about who the fund will serve and benefit.
Thank you, Jasmine. So as Jasmine stated, we have multiple phases. So because the development of this fund is iterative, we understand that, and we want the community to understand that it's growing and it's changing and it's evolving based on needs. And right now we recognize in phase 1 that the need is for direct disbursement to residents. And so we right now are looking at, in phase 1, supporting residents with our goal of reaching and raising $1 million in phase 1 in the next few months. And like Jasmine stated, we are actively, talking to and seeking funding, and we'll talk a little bit more about some of the exciting things that are happening in terms of how funds will be coming in. But our goal is to provide $500 direct disbursement cash to Richmond residents that are in need, which will total, 2,000 residents. And we are identifying these families through a referral process that is being developed right now with multiple direct service partners that engage in the larger Community Cares Coalition calls that Jasmine was referring to. And these are organizations in terms of the direct partners that we're working with that have longstanding relationships in Richmond, really great track records, have the ability to connect with residents, know who these residents are, and can provide direct disbursements to them. Some of these organizations include Youth Enrichment Strategies, Lifelong Medical, the County Probation Department, the East Bay Center for Performing Arts, Rubicon, and Healthy Richmond, and that's just to name a few, and also includes the core partners that were already discussed on the call. And weekly calls are being held with these funding partners to make sure that the disbursement and intake process is collaborative, streamlined, and coordinated. And that's really important for us. So that's phase 1. And as Jasmine stated, phase 2, which we will then start to focus more on small business support and nonprofit organizations so that they can continue to provide the necessary services to our residents. And phase 3 will be more looking at community needs assessment and ongoing infrastructure support and advocacy, because we know that the recovery of after COVID will need to be one that is an equitable recovery. And so we want to continue to be in partnership with one another and collaborate to make sure that we can really meet the needs of our residents and our businesses. And then I'm turning it back over to Jasmine to talk about how funding will be dispersed.
Absolutely. So as LaShonda mentioned, we're only 5 weeks into the fund being launched. Really exciting, but we haven't raised a ton of money yet. This was an opportunity. The website is up to kind of share with people that a fund exists and they can give to this fund, and it will support the residents in Richmond. And so to date, we have about $50,000 in the account. And really, it's thanks to Mayor Butt and Hellman for that initial seed investment to this fund. We've also entered a partnership with East Brother Beer Company, and they're donating 20% of their proceeds from their recently released Pride and Purpose brew to the fund. And so we recognize that $50,000 is only a drop in a bucket towards our larger goal of 1 million. And so we're continuing to have conversations with partners to develop the process in hopes that we're going to be able to give resources out beginning in June, like mid-June. We're also want to raise more money. And so this is kind of like a call to action and to share the news with folks that the fund exists. And if you want to support our community, this is a way to do that. Some of the larger funders that we've been in conversations with are the San Francisco Foundation, the Hellman Foundation, SH Cal Foundation are just a few of them who said, like, we really want to support you. The California Endowment Foundation is also one who reached out to share interest in supporting this fund. And so right now we're just having conversations. The actual website went up on May 5th, and we've been in several conversations with multiple partners to bring resources in. And simultaneously, we are developing the process. And so we're doing two things at one time. We're fundraising and developing the process to get the resources out. And in terms of being engaged, if you want to know how to join the call and learn more, you can reach out to either LaShonda or I, and we can get you connected to kind of the larger coalition of folks that are in this process. But that's how we're thinking about getting funds out and how we're prioritizing the different needs. And so I'll turn it back over to LaShonda in case you had anything else you wanted to add.
I just want to make sure people know what our website is. It is richmondresponsefund.org. So richmondresponsefund.org. We have F8, which tells you more about the fund, has frequently asked questions on there, talks about the different phases and timeline. It tells you about, once we broaden it, what are the different strategies that we want to fund. And I just want to highlight those really quickly. Food, essential supplies, and economic security as one of the strategies, housing and homelessness, health and healing, and social and legal services. So those are some of the different strategies and areas that we really want to focus fundraising around, and then providing support to organizations and individuals that have needs in those areas. So richmondresponsefund.org. You can donate now. Every dollar counts and will add up.
And just actually, I wanted to add there, 100% of donations are going to go directly to families. We're not taking any administrative fees or anything like that. We want to just get the dollars into the door and out to our community residents. As the city manager said, there's about 11,000 people who are seeking work and cannot right now. And so we know that our community can really use this resource. I also want to note that the website is both in the chat and in the question and answer box. And so if you want to check it out, you can check out the information there.
I'm sorry, finally, I just want to thank Jasmine. She, as part of the Ed Fund, they are actually they're holding the fund for us right now. And so we just are really thankful for that partnership. And we do understand $500 is not going to meet the needs of every resident. Only at phase one, our goal is to help 2,000. But that's why this fund is not just for right now. We want it to continue so that we can continue to work together with community-based organizations, government, philanthropy, to continue to focus resources on Richmond to meet the needs of our residents. So we're really excited about the work we're doing right now and the continued work. And thank you to all our partners who are not on this call.
Thank you.
Thank you.
Thank you both, LaShonda and Jasmine. We appreciate this. And I think this was a great opportunity to talk about the fund and how people can come in and support. I am a local Richmond girl myself, and I know that there are a lot of people from Richmond who still care about Richmond. And I would just encourage everybody on this call, please share this through the Richmond network. Talk to all the people you went to school with, those of our Richmond folks who have made good, and encourage them to support the fund, because we're really gonna need it, not just now, but throughout the entirety of COVID and the recovery process. So thank you both.
Thank you.
So now we're going to go into the portion of the town hall where we're going to answer some questions. And so the way this is going to go is it's going to be moderated. These were questions that were sent in by Richmond residents, so by you, of questions that you wanted to know the answers to. So I have the first round of questions to be able to moderate, and their follow-up to LaShonda and Jasmine. Some of these looks like you all have answered, so maybe you can just kind of encapsulate it in a nutshell. But the first question that I have is from Diane Aranda, and Diane writes, I'm curious to hear more about the decision-making process, transparency, and decisions on how the R3 fund will be used, and how you all are prioritizing those mid to long-term strategies that you're working on. So I'll turn it over to either one of you if you would like to answer that question.
Great. So thank you to Diane Aranda for the question, and it really is an important one. We take very seriously transparency, and as Jasmine and both of us talked about, there's this call that happens on a weekly basis with over 100 community partners, and it's community in terms of community-based organizations, philanthropy, and governmental entities that are talking about this fund and they're working through the development of the fund with us. So we're not doing anything in a silo. The city is not a City of Richmond fund. It benefits residents of Richmond, and we are one player on the team that is developing this fund. And so it really is about a collective decision-making process that is happening with the core group, and then we really expand it and broaden it to make sure we are benefiting from insight and information, expertise from others through these weekly collective care calls. I mean, that to me is about the transparency part. We also have the website where we're trying to make sure we're sharing who we are, what we're doing, that everything isn't figured out, and that, in phase one, we're trying to just make sure that money gets out the door, but that in the future, we're making sure organizations are coming along with us in the process to determine how we're going to focus on different strategies. And I did highlight some of the strategies that we're looking at in terms of phase two. And so we are always looking for feedback if we are missing something, if something, we haven't highlighted something, so we want to make sure people are very aware of what we're doing. We also have adopted some guiding principles amongst the partners that foster shared decision-making, and we've, like I said, been meeting regularly. We're doing some needs assessments and understanding what the needs of our community are through the intake process. Jasmine, I don't know if you have anything else you want to add about that in terms of transparency or strategies?
I would just say in terms of transparency, part of being transparent is a sharing on virtual town halls like this. We were on a virtual town hall last week with East Brothers Beer Company. We want people to know about this resource and that they're connected to the partner groups, or that they kind of get engaged in the process, so that people feel that they're a part of this, and that it's not like, oh, this group over there is doing something. This is a real, true collaborative effort with many key stakeholders across the city. And so we're not hiding anything. We want people to be engaged. And so if you have any questions or you want to be involved, please reach out so we can get that information to you.
Thank you both. I think those were great answers. Just wanted to encourage people. I see a couple hands up in the chat. If you have questions, make sure you go to the chat. There's folks in the chat who can definitely answer some of those additional questions that people might have. I see a hand up. I don't like to leave my hand up for a long period of time. So make sure that you scroll back to the Q&A and we can definitely kind of answer your questions if you have anything additional that you want to have answered. There was a follow-up to that, and the follow-up question comes from Blanca Gutierrez, and that was which organizations were selected to make referrals around the R3 fund. I think you all answered that question. And then there was another follow-up by Coletta Hunter, which is what is the amount of the funding that's going to be supplied and when are disbursements happening? I think you already answered either one of those, but if Jasmine, if you want to answer that quickly.
I do want to add something to the part around the disbursement partner specifically. Just this week, we had 2 calls where people who are part of that Community Cares Coalition volunteered to say whether or not they were interested in being a disbursement partner. So again, we're not directing people to do anything. It's all about, how people want to step up. And so people volunteered to be disbursement partners. We had kind of info sessions with those disbursement partners on Tuesday and Thursday, and we're continuing to have conversations and iron out like, well, what does this disbursement partner mean? Who can be a host? There will be a couple hosts that will actually get resources out to folks, and other organizations will be able to refer their members or their clients that they work with to those hosts. And so like those are the processes that we're ironing out right now. Yeah, and I'll stop there.
Thank you. And I'm going to turn it over to Chris.
All right, thank you so much. And before I get to the next question, I do want to also clarify that if you do want to pose a question, please use the Q&A function, not the chat. I think I may have misspoke in my introductory remarks, so I apologize for that. If you have a question, please go to the Q&A, not the chat. And again, we do have some colleagues there available to answer questions you may have. So the next category is COVID-19 Richmond impact questions. The first question comes from Paula Kristovic, who asks, what are the city of Richmond statistics for COVID-19 cases and deaths in terms of demographics and different neighborhoods? And Paula also says, I would also be interested in knowing about donations and volunteering. And so I'm going to kick this question over we heard about donations with R3F, but I will kick the question over to Chief Sheppard and Genevieve Pastor-Cohen to comment on Richmond statistics for COVID-19 cases and deaths. Chief, do you want to start that?
Sure. Thank you, Christopher. And good morning, Mayor Butt. Good morning, Manager Snideman, and good morning, Richmond community. Fire Chief Adrian Sheppard here. As far as the first part of the question and given statistics, Contra Costa County Health does not provide statistics at the city level. However, I can share with you that to date in Contra Costa County, there have been a total of 1,089 cases throughout the county that have resulted in 33 related COVID deaths. And though these are not ideal numbers, they are indicative of the fact that we are doing a good job, but we are flattening that curve and we are keeping our numbers low. With that in mind, I do want to give you some factors for consideration as a community and how you can identify if you're a person at risk and how we can prevent ourselves from actually being a casualty of COVID. And first and foremost, we should understand that people who are age 65 and older, you're at increased risk. If you're a male, you're at increased risk. People with underlying medical problems, cardiovascular, liver disease, if you have hypertension, diabetes, these are things that put you at increased risk. If your BMI is greater than 40, and other factors as well. If you live in a long-term care facility, if you're living in a nursing home, that's an increased exposure for risk. And something that is very particular to the city of Richmond that I think is important is if you live in a multi-generational household. That is something that is not too uncommon with our Richmond community. The reason being is that we live in tight quarters. We have young people who move about, elderly people who may not move about as much, but young people may bring something in. So those are things for the Richmond community to consider to make sure that they understand whether or not they're going to be at risk. And no, that's not an exhaustive list, and I do encourage you to go to the CDC website to find out more. That should be a good start. I also want you to know that one of the best ways that you can prevent contracting COVID is by making sure that obviously washing your hands. You've heard that time and again. But one thing that came out in the health order that I think that is very important is the emphasis on wearing face coverings. County health officers stressed that if we wear these face coverings, we are going to continue to flatten this curve. So what they require is that people who are within 6 feet of other people outside of their household, when you're out in public, making sure that you always carry a mask. We're also saying that children under the age of 12 are not required to wear the mask and certainly don't want to put masks on children under the age of 2. What can be a face mask? Well, one thing, we don't actually have to go out and purchase a face mask. You can make one at home, something cloth, bandana, something like that, t-shirt. All you have to do is put that over your face when you're out in public. We'll be very happy. There is one concern that we have, and I'll let Michelle answer this a little bit later on after I finish my remarks, but we need to be able to have greater outreach into our at-need population. We have a disenfranchised population, we have homeless population out there, and I know we have programs where people can actually go out and meet with these people and get masks to these people as well, and also make them aware of the county health order. Additionally, since I bring up the county health order, the new county health order, as Manager Snideman commented, new construction or all construction can resume in the city of Richmond. Real estate transactions can resume. Certain outdoor businesses can resume, as Manager Snideman indicated. Landscape businesses, supply businesses, as long as it's an outdoor type business, nurseries, stuff like that, yes. What does not, or what is not included in that is an outdoor type seating situation for restaurants. So cafes, stuff like that are not included in the new health order. And additionally, the resumption of physical activities, things you can do outside. We want people to be able to get out and exercise. If you're going out running, make sure you have good separation between the person in front of you, person behind you. Make sure that we're not breathing hard and actually getting particulates onto people as we run. Making sure that if we're engaging in some sports activity that we're not using shared equipment. That's very important, but we do want you to get out as appropriate under the guidance of the health order to make sure that you continue to be healthy. And with that said, as I said, Michelle will give more information, but I'll go ahead and turn over things to Genevieve for further about volunteering and PPE.
Thank you, Chief. And just to emphasize again, please do wear your face covering. I'm Genevieve Pastor-Cohen. I'm the Office of Emergency Services Manager, and I'm glad to be here with the rest of the panelists here to help share some helpful information to our community. With regards to Paula's question about donations and volunteering, we have a great website, the coronavirus website on the city's webpage. And I really encourage you to go to that website to click on some of the opportunities that are out there for you today. There's also too, she asked about PPE. When it comes to PPE, in the past couple of weeks, we've had some donations collection points that we've been able to collect a number of items, especially for some of the childcare areas that were needed. And the county was working on that. And also too, I wanted to emphasize that GRIP right here in Richmond is really in need of masks. So if you within your community are able to make masks, that they would love to have the type of mask that goes over the ears, kind of like this one here. So there are ways that you can volunteer to make masks. Also within your neighborhoods, and within your communities, especially faith-based as well. We encourage you to reach out to those people who are within the vulnerable populations to make sure that you're making that community contact, because there are community members who are remaining at home and need the contact. Even if you just phone them, get to know who those individuals are so that you can stay connected, because we are human beings and we love to communicate with each other. And to make it through this COVID-19 incident, we need to make those community connections within our neighborhoods as well. I'll be talking about more connection type of activities in another part of our presentation here. Thank you.
Thank you, Genevieve. And before passing it over to Michelle for the next question, I do want to point out, so in Genevieve's remarks, she did mention the City of Richmond's website and the great coronavirus information page that we have there. I do want to let you know that at the end of this town hall, I will be sharing my screen so you can see the website. and I will be walking you through a couple of the features that we have there that Genevieve mentioned. And I also want to very quickly just emphasize what Genevieve said about grip and needing face masks. Last week, the mayor's office, the mayor received face masks that look like this from the US Conference of Mayors. And the mayor is going to be donating masks like this to GRIP. So individuals that need PPE, that need face masks, like Genevieve said, can have that so that they can stay healthy during these times. So we're thankful for the mayor for making a donation to GRIP, and we will be giving these masks to them soon. And like Genevieve said, any more donations to GRIP would be much appreciated. And with that, I'd like to pass it over to Michelle for the next question.
Thank you, Chris. So I have the next couple of segments of questions. And before I do, Marjorie has her hand up. Just make sure that you, if you have a question, there is a Q&A feature. So make sure you drop in there. We have some folks who are answering questions in there and really appreciate our Q&A moderators that are doing that. So the public safety impact questions, the first one comes from Wyatt, and I think it's TAC. I think the P is silent. If I mispronounce that, please forgive me, Wyatt. And Wyatt's question is, do we have enough PPE equipment for a surge? So I'm going to direct this to Chief Sheppard and then Chief French to answer.
Thank you, Michelle, and thank you for that question. So do we have enough PPE for a surge? That is the constant challenge that we've been confronted with. Currently, our responders do have the appropriate PPE to meet the what we see in the immediate future. However, with the anticipation of a surge, we want to start to stockpile. But we're also confronted with the challenge that we understand that the supply chain is somewhat broken, and at the same time, there are other responders, not necessarily in Richmond, but throughout the region and nationally, who actually need these supplies as well. So yes, we have supplies today. Yes, we are continuing to receive supplies, even though we have challenges. But at the same time, we want to balance it and have a stockpile in time for the surge. So hopefully that does answer your question.
Thank you. And I'll also turn that over to Chief French to talk about PPE for first responders and the police department.
Thank you, and good morning, everyone. So the short answer is yes, we have a current adequate supply of PPE. However, we're assessing this on a daily basis, making sure that we're ordering appropriately so that we don't get behind, but also balancing that, like Chief Sheppard said, with the needs of others and making sure that we're not hoarding any supplies. We keep a list of vendors current so that when we do need to order, we have that information available right away. This is important because we want to make sure that our officers are staying safe when they come into contact with people. Just this week, we were notified now everyone that's being arrested and going into the jail, the suspects going into the jail are now being tested, whether they're symptomatic or not. And we had a person who was arrested that was asymptomatic just this week, test positive. And so that means that we want to take precautions here with our officers. So all those officers that were in contact with that particular person, we're sending to get tested to make sure that they're not going to come back into our workforce and infect other officers. So we're taking the appropriate precautions here, but that means that our officers are continually needing masks because they come into contact with people constantly during their shifts. And we want to continue to make sure that we have a good representation of police officers to be able to respond to those calls for service. So just reminding our officers on a daily basis that they have to wear their masks and they have to wear the appropriate PPE to keep the entire workforce as well as the community safe. Thank you.
Thank you, Chief. So I also have the next round of questions. And this question actually comes from Sophia Ritchie. And she wants to know about local efforts ranging volunteer virtual mentoring and to tutoring for local students, and also about volunteer efforts in general. And I know there's been a lot of talk about needs for volunteers, specifically for students who need tutorial services and also volunteerism that we've talked about a little earlier today. So I'm going to turn it over to Mayor Butt, and then we'll have a follow-up with Genevieve.
Well, I'm sorry, I don't have much information on mentoring or tutoring local students, but I can provide some detailed information about volunteering and about other ways to help students. As you know, this crisis has left many without ways to be able to provide food or groceries for their families. We also have a significant homeless population that's still in need of meal services. The West Contra Costa Unified School District is providing meals to families at many Richmond locations, including Kennedy, Richmond High School, and Dijon, Neestrom, and local churches. Any way you can support the district effort goes a long way in providing families with these essential meals. The district has 17 meal pickup locations for students 18 years or younger from 11 a.m. to 1 p.m., unless noted otherwise, Monday through Friday. And they need people to help assemble these meals. So they are looking for volunteers. As mentioned before, the Greater Richmond Interfaith Program, GRIP, is one of our local homeless services providing organizations can utilize your help in several ways. They're serving about 650 meals per day to our homeless population. 100% of their feeding program is now takeout, so they're also in need of these supplies. They also need volunteers to help cook and serve the homeless fresh fruits and vegetables and take out container trays for meals. For more information on how you can help, you can visit their website or the city's COVID-19 page. We'll show the website at the end of the town hall. Thank you.
Thank you, Mayor. And the mayor did a good job, I think, of summarizing some of the food issues that we have and people getting those basic supplies. Genevieve, can you follow up a little bit about the tutorial piece?
Sure. Also, too, before I do that, I wanted to mention that the Contra Costa Food Bank supplies many of our meal serving organizations, and they're supporting your local food bank in one of the ways to help those who are struggling to make ends meet at this time. When it comes to some of the other programs, I understand that our library has a virtual math homework helpline, and I'm checking with them right now to find out if they're needing volunteers for that purpose. But also too, Richmond Promise, they're seeking mentors to assist Richmond High School students in academic, personal, and career successes. And it's a mentoring system where they anticipate it only being 1 hour per month, and the commitment starts August 2020 with a minimum of a 1-year commitment. So if you're interested in mentoring a Richmond student, just go to the Richmond Promise website, richmondpromise.org. So that's one of the areas where students are needing some help and where you could volunteer. And just before I sign off on this particular topic, I just wanted to remind everyone to always, when you step out of your house, wear a face covering or have one readily available in the event that you'll be encountering folks along your path, as well as when you're going shopping. And also frequently wash your hands, and also keep some hand sanitizer on your person so that you can sanitize your hands whenever possible. Thank you, and I'll turn it right back to Chris.
Thank you, Genevieve. So our next question pertains to homelessness and COVID-19. This question comes from Charlene Harris, who wants to know, are there plans to begin testing City of Richmond residents or those at high risk for contracting COVID-19? And Charlene also notes that, of course, there are individuals who are homeless in our community and, of course, across the county that unfortunately may not be in compliance with social distancing, and wants to know what can be done in order to support, again, testing for Richmond residents, testing those who are at high risk, and testing and supporting individuals who are homeless who may not be able to remain in compliance with things like social distancing. And I will actually turn this question to my co-moderator, Michelle.
Thank you. So I am wearing multiple hats here this morning, and I want to first of all thank you, Charlene, for your question. It's a great question. So the question is really, what are we doing about testing for the homeless and those who might be in encampments? And I think it's important to note that the county has a division that actually responds to homelessness, H3, that provides the services to our homeless population, including being able to set up testing practices for the homeless. And the city of Richmond helps coordinate with that. We help provide various services to our unsheltered population and work closely with the county on some of these things. So the way that H3 is kind of looking at this is that there's a 3-phase process that they have set up for how they identify folks who may have COVID in the homeless population, how they provide outreach and education to them, and how they get them tested. And the first thing is, and you probably heard this, is since the governor's order came out about shelter in place statewide, is that the homeless are exempt from the shelter in place ordinance. We're not doing very much enforcement in homeless encampments unless it's an extreme safety matter, because one, they don't want to break up a group of people who have contact with each other. In the event that someone should get COVID-19, they want to be able to try to isolate who may have had contact with whom. And if you think about this, it's kind of like your house. You're living with a group of people perhaps, and that's part of the reason why they want us to social distance and stay with people in our house or community, because it's easier to be able to track and trace when we know who we've come into contact with. So that's one of the things they're doing. The second thing they're doing is wellness checks. So they have health care for the homeless going out and responding and being able to do temperature checks, along with the coordinated engagement and response team that the county has. The city actually has a contract with the county to provide additional services to our homeless community. And those are outreach workers who go out to the encampments, connect with people. They're trained to be able to recognize signs for COVID-19. And if they see someone who looks like they have COVID-19 or may, present symptoms, they can take them to testing sites that the county has and isolate them in hotels, get them medical treatment. So that's the response that they have there. And then just in terms of, follow-up, the county does have some plans for surveillance testing of at-risk populations. I don't believe that's up and ready yet, but when it is, we'll make sure that we share that information with you. And they also have some plans set up for mental health consumers to be able to get access to testing. So a lot of that testing is done at the county level, but there has been some coordinated thought about how we identify that in our homeless populations. And one of the reasons why the city of Richmond has worked with the county to install some of the portable potties that you may see around the city in some of these locations, so people have access to hand washing, because if you don't have a place to go, it's very difficult to wash your hands and do all these things that our public health officials are telling us to do. So thank you very much with that, Chris.
Thank you, Michelle. So our next question comes from Laura Toscano. And this is a common question. I received this question right before this town hall, actually, or a question similar regarding rental protection. Laura says, what is the city of Richmond doing to help low-income residents from being evicted for non-payment of rent? Most residents will be backed up at least 2 months on rent, will not be able to pay back backed up rent. What is the city of Richmond doing to help families that are not able to pay April and May rent? And I will actually direct this question to our city manager, Laura Snideman.
Great, well, thank you for that question. And as mentioned earlier, this is a specific example of some of the very significant impact that the pandemic is having on our residents. And starting the day after the very first order was issued by Contra Costa County back in March, we started taking steps to try and protect residents and now commercial tenants to make sure that they have safe places to stay, because staying in housing is obviously incredibly important during a pandemic. Many people might not have realized that the first order actually made it illegal for anybody to move during that period of time. So we have passed multiple orders that protect both residential and commercial tenants. They provide that the residential and commercial landlords are prohibited from evicting tenants for non-payment of rent if that non-payment is due to financial circumstances caused by COVID-19. So it also prohibits the no-fault evictions, such as owners trying to move into a unit. And so unless it's necessary for the health and safety of the residents, the neighbors, or the landlord. We also have provisions in place that allow time after the shelter in place is lifted and under certain circumstances that allow you to continue to repay your rent. So at this current time, tenants have 6 months from the end of the emergency to repay that deferred rent. And it also prohibits landlords from issuing rent increases to rent controlled tenants and tenants of housing tax credit properties that were built before 1995. So we already have certain rent restrictions in place. This goes beyond what we already had. To be able to get assistance with this, our rent program has been great and has a lot of different ways they can help folks. They can help educate landlords on the provisions of these special orders. They're also offering counseling, both by phone and by email. They can even help mediate at the end of this crisis, the rent repayments with the landlords in case you need additional time. And they also can connect you with other resources such as the Eviction Defense Center or the Bay Area Legal Aid if we think that the stronger measures are needed. There are 3 ways to reach our rent program. The first is by phone, and that phone number is 510-234-RENT, R-E-N-T. And so the full number is 510-234-7368. You can also send an email to them, which is rent@ci.richmond.ca.us. And finally, they have their own website, and that website is www.richmondrent.org. So again, that's www.richmondrent, which is all one word, .org. So I believe that there's plenty of resources for folks who are having difficulty, in addition to the Richmond Rapid Response Fund and other organizations that are coming into play to help with this very significant issue.
Thank you very much for that response. So the next set of questions that we have is pertaining to small business help. And this is a question that comes up over and over again. So I'm going to read the question. The question is from Amanda Elliott. What is the city of Richmond doing to help support small businesses through the crisis? And so she wants to know about ways that the city is taking leadership, perhaps potential grants or subsidies that are being offered. And so I'm going to turn this over to Mayor Butt with a follow-up by Chris Whitmore with some of the city programs that are being provided.
Thank you. You know, the mayor's office has convened a working group of business leadership, including the Chamber of Commerce and Richmond Main Street Initiative, along with city economic development staff to develop strategies to encourage Richmond residents to support local business. Though many businesses are impacted by the shelter-in-place order, some are still open. I strongly encourage everyone to shop local. Local businesses need your support more than ever. There also are several small business resources that can help during this difficult time. I encourage you to visit the city's website, which we maintain. And now I'd like to turn this over to Chris to give you some more details about these programs.
All right, thank you, Mr. Mayor. So the first program that I will highlight is the Small Business Hotline. So recently, the Workforce Development Board of Contra, Costa County started operating a hotline to connect businesses and workers to helpful federal, state, and local programs. Businesses and workers can call 833-320-1919. Again, 833-320-1919 to receive resources and referrals about loans, grants, unemployment insurance, payroll subsidies, and other issues of concern. Also, there is the Disaster Unemployment Assistance, which is administered by the U.S. Department of Labor, Employment of Training Administration. Disaster Unemployment Assistance programs provide unemployment benefits to individuals who have become unemployed as a direct result of the presidential disaster that was declared. Please, if you have access to the internet, go ahead and Google the Disaster Unemployment Assistance through, again, the Department of Labor, and you can get some more information there. Also, as many people know, the SBA has an economic injury disaster loan program. So the Small Business Administration through this loan program offered up up to $2 million in assistance for small businesses. And you can visit SBA's website, Small Business Administration website, for more information there. Also, onwardca.org is another resource for small businesses. This is a one-stop shop resource for individuals in the state of California impacted by job loss due to COVID-19 financial impacts. So if you are, again, an employee who is impacted by job loss, visit onwardca.org for assistance there. Also, you can file a state unemployment insurance claim. The Richmond Revolving Loan Fund is offering assistance to Richmond businesses, and you can visit the City of Richmond's website for more information on the Richmond Revolving Loan Fund. And lastly, Richmond has a Kiva loan program, and Kiva is a small loan match program where you are required to raise $1,500 on the Kiva crowdfunding website, and the city will match that fund. And so if you are a small business and you need some support, you can also look into the Richmond Kiva loan program, and you can also visit the city's website or Google Kiva and go to that website as well. So now we're going to move on to our next section. This is a question regarding economic hardship. And Gloria Racinos says, let's see, I would like to know where I can get help because I have not worked for 3 months, and I unfortunately do not have enough food, and I'm just Gloria's just in a tough situation. And Gloria is looking for assistance from the city, support and direction from the city regarding her economic hardship with financial support and food security. And I'm going to ask, again, my co-moderator, Michelle Milam, if she can take on this question.
Thank you, Chris. And thank you, Gloria, for sharing that. That is really something that touches my heart because I know that a lot of people are going through tough times right now, and we have to figure out how to pull together to be able to support one another through this, not just now, but throughout COVID. So the first thing, I can't tell from your question if you're eligible for unemployment. You may or may not be. I know that EDD is very backlogged, so a lot of people are applying for unemployment. We have unemployment in record numbers. I know that the governor's office is really trying to work to speed and fast track some of those applications so that more people can be able to get the benefits that they need if they are seeking unemployment. But I would encourage you to do that. If you need help from the city to connect with people and you're having a hard time getting through to EDD, let us know. We have various relationships with our state offices. We can try to work with you to do that, even though it's not a city function. So that is something that we would be happy to refer to you. And unemployment has been expanded to cover workers, which is something that was really mentioned in the context of this discussion, is expanding some of those services. There also are various folks who are in similar situations trying to figure out ways that they can find out how to get groceries and how to do things to help sustain themselves. So if you're not if you're not getting SNAP benefits or anything of that nature, there are some directories that are available. The county put out a directory about food services that is on the county's website and also on the city's COVID-19 website. And it shows you all throughout the county, including Richmond, city locations, nonprofits, the school district sites that were talked about before. The Contra Costa Food Bank just did some grocery distribution where people can help get support with food assistance. And we'd be happy to work with you to help you identify some of those ways that you can get connected. I would also encourage you to contact employment and training because our employment and training offices are not open to the public physically, but we are open for phone calls and other ways for the public to be able to connect. And you can have an employment and training staff member work with you through some of the questions that you might have about seeking employment and being able to find employment. One of the things that just happened recently is Richmond was awarded a grant. It was $575,000 for COVID impacted workers. We know that a lot of these jobs that are impacted, some of them will come back, some of them may not come back, and we may have to retrain people and help people get into new occupations to be able to support themselves. And so employment and training is there to do that for you. For those of you all who are in the chat and my chat moderators, if you could drop a link to some of those resources, that would be great so everybody can be able to connect. And we'd be happy to connect with you on that. And many people are in the same position. I think I said this on the last town hall, and I'll say it again. We have to be better together. There's no one entity. There's no one resource. There is no competition when everyone is impacted by this, and everyone is suffering from this. We really do have to come together between state, county, federal, nonprofit, faith-based organization, community-based organizations to be on the same path. And that path is for the resiliency of Richmond residents. And that's one of the reasons why we wanted to have this town hall and bring this town hall to you, because of questions like Gloria's. So I just want to thank you for sharing that with us. And if there's any other way we can assist you, we definitely will. So at this point in time, we've come to an end of our question segment. And I think that I'm going to turn it over to Chris to talk a little bit about the COVID-19 website, and then I'll double back to talk about Richmond Cares, the Richmond Cares hotline.
Thank you, Michelle. So at this time, I'm going to share my screen. And I'm going to, so right now you see the Richmond Response Fund website, and I'll get to that in just a minute. But right now I'm gonna share the City of Richmond's website, ci.richmond.ca.us. And so here on our website, you can see there, of course, several different tabs, several different options. And I wanna direct you to the city's coronavirus information page. And there are actually two ways to get here. You will go to the page and you'll see this bar here at the top of the screen. And also there's an icon here, a microphone icon that says coronavirus information. And I'm gonna go ahead and click on that icon. And now I've been directed to the Richmond novel coronavirus information page. And what you will see here is really Richmond's one-stop shop for community members to get information on not only what's happening here in Richmond, but what's happening in the Bay Area, what's happening in the state of California. And it's really just intended to keep you informed on many of the questions that you may have, and many of the questions that have been addressed in today's town hall. You may also be able to find answers here as well. So you see here recent updates. These are updated regularly with press releases, volunteer information, food bank giveaway information, something that staff really tries to update on a regular basis to keep you informed. There are also several buttons here, information about shelter in place, information about health and community resources. Again, the Richmond Rapid Response Fund that we've spoken so much about on this town hall today, and also other ways that you can help now, help your community now. We have what Michelle is going to talk about in just a minute, information about the Richmond Cares hotline. We have information here in both English and Spanish. And again, as I mentioned before, information not only on what's happening in the city of Richmond, but really in the state of California, Contra Costa County, and beyond. So Contra Costa County Health Services website is linked here. State of California's Public Health Department is linked here, and Centers for Disease Control linked here as well. On the side, I believe the right-hand side, there should also be a tab for frequently asked questions. So we understand that your questions didn't start with this town hall and they're not going to end with this town hall. And so if there's any information that you're still seeking, again, please come to this website, look at the frequently asked questions page. Please use some of the tabs that you see here, and please utilize all of our phone numbers, mayor's office, city manager's office. If there's anything that you can't find on this website, we'd be happy to talk with you and help you get the information that you need. And so now I'm going to turn it over to Michelle to talk about the Community Cares or Richmond Cares hotline.
Thank you, Chris. I really appreciate it. And I think one thing that we should note is that not everybody is technologically savvy. Not everyone has access to the internet. There have to be multiple ways for people to get information. So we also created a Richmond Cares hotline, and that's where I believe that the hotline number is on the bottom of the website, but I'm going to repeat it to everyone. It is 510-620-6700, English and Spanish. You can call during normal business hours and you can get answers to your COVID questions. So if there's a question that you have, if you don't see the answer on the website, if you don't know how to find the answer, or if you just, are looking for a way to be able to get something answered that you just have in your mind that you haven't really been able to find some good information about, please call that hotline. This is also great for people who are bilingual because we have a lot of folks who are bilingual. The website can be translated into Spanish. There is a tab there to translate the website into Spanish. But you can also encourage people to contact the hotline, and we do have bilingual staff to be able to answer some of those questions. And then finally, I just want to make it very clear, I'm a very big believer in transparency. No process is perfect in terms of informing the public. So the part of this that we need help from is from you. If you have suggestions, if you have ways to be able to share and amplify the information that we have with other groups, constituency groups that need to be reached out to, please get in contact with us. We would love to be able to work with you on that. That's part of what this process is all about. So we really appreciate the input that we get from the community. And if you want to get alerted about stuff that goes on like this, there is a tab on the website that is to subscribe to coronavirus information. We have 5,000 subscribers so far. That's 5,000 subscribers in a month. We'd like to increase that. I'd love to see that go up to 10,000 subscribers. But the only way that happens is if people like you share the information with others who may not have access to. So if each one actually shares information with someone else, then we can definitely increase that. And so when events like this go on, there's many different ways we share it, but we can get that information out to more people. And we would love to have your partnership to be able to do that. And with that, I think that brings us to the end of our forum today. We went over a little bit on time, but I think that I really appreciate all the panelists who stayed with us through this process because we had a lot of great questions and a lot of good information. And I just want to also add, thank KCRT staff. This has been broadcast live on YouTube. Hello to everyone on YouTube who's watching us at the same time. And we will send a link of this particular broadcast out so that other people who weren't able to make it on the call, we realize not everybody's able to make it on the call, will be able to get this information and will be able to be shared again. And the only thing I ask that you do is when you get that link, share it with someone else. And that is the end of my update, Chris.
All right, thank you so much. And again, while I'm sharing my screen, I would love to, again, just direct everyone's attention to the Richmond Rapid Response Fund. So thankful that LaShonda and Jasmine could present with us today. I've been a part of this initiative and I'm just very appreciative of the opportunity to work with so many community leaders to establish the Richmond Rapid Response Fund. As you heard in the presentation, over 90 stakeholders, 100 stakeholders have come together to really offer this great initiative for the city. We're very thankful that the mayor offered $25,000 through a contribution for the Richmond Rapid Response Fund, and encourage everyone to visit the website, richmondresponsefund.org, to learn more information. If you have the means to do so, please consider donating to the fund to help Richmond residents in need during this time. If you are a business owner, philanthropist, work for a foundation, please visit the website. Please contact LaShonda or Jasmine Jones to learn more about this great initiative. So I will just leave this website up on the screen for the last couple seconds of this call. And I again want to thank everyone for joining us today, for asking your questions. And we look forward to continuing to engage with you and make sure that you are up to date with how the City of Richmond is responding to COVID-19 for our community members. So thank you all so much.